Myopia in children might be grabbing all the headlines, but adults are also in the disease's crosshairs. Myopia can have a drastic effect on an adult's vision and quality of life, too. So what to do? In a recent Cake magazine supplement, a consensus group of 11 world-renowned experts came together to frame the discussion on the current myopia correction landscape, including phakic IOLs. Postoperative care is an oft-overlooked but key part of the ICL journey. The panel's findings heavily stress the importance of early postoperative care after an ICL implant and for the need for the patient to be compliant to follow-up visits.
我的常规的术后随访时间是术后1天、1周、1个月、3个月、半年，还有1年。以后的话，希望他每年都能随访。
So my routine is the same as refractive surgery, cataract surgery. I measure everybody at day 1. Actually, during the surgery day, I don't let them go home until I'm sure that the pressure is good. So we monitor them for 2 to 3 hours before we discharge the patient. So the next day, my most important concern is the pressure. Because I know that the eye may be still swollen, edematous, and all that. Whatever it is, it will heal. But the pressure is the most important to check the next day. And then vision will be better at 1 week and at 1 month. So the minimum is the 1 day, 1 week. And then the 1 month, maybe you can stretch it to 2 months, 3 months. But the 1 day, 1 week is the critical time.
I do personally perform the simultaneous bilateral surgery in 1 day. So I do make a follow-up on next day and seeing the vaulting by slit lamp and also intraocular pressure check and the autorefractive errors. And then I make a month, and 3 months, 6 months, a year, and after a year, I make a year annual follow for the ICL patients. Because we are dealing with the myopes, especially high myopes, we do check the OCT in not only the anterior but also the posterior, where the myopic macular degeneration might be there. So full comprehensive examination over all the eye will be very important. For the 6 months follow-up, I do check the endothelial cell count. So I told the patients that you should come and visit me once a year, every year, until you die. The loss of endothelium doesn't have any symptoms. So you are seeing fine, but if you have a little less number in your endothelium, then you will be in big trouble.
Communication can go a long way in the journey of a happy ICL patient. The panel stressed that both an understanding of candidate expectations and effective communication with candidates were important in obtaining optimal results from the procedure.
我觉得非常重要的一条就是，当你和每个病人交流的时候，你要让病人知道每个人的情况是不一样的，所以他能够得到的结果也可能不一样。你要让病人了解这个手术的优点和缺点，同时给他们一个比较理想的或者是合理的一个期望值，不要过于的有太高的或者不切实际的一个期望。
Most of the patients are not very familiar with the phakic IOL. So I spend more time with the patients that explaining how it goes and what's the advantage of the ICL. But also I have to explain the disadvantage of the ICL because being informed in pros and cons is very important to decide how to have those surgery for me. The most important thing for nowadays is that it's being reversible. If you are complaining about the visual quality, poor visual quality, if you are done with the laser, it is very hard to compensate. For the ICL, most of the patients are very comfortable and being satisfied with the result. But if you are not really satisfied with the result, then we can get rid of it and you can go back to what we used to be. So
For phakic IOL patients, number 1 is I tell them that all refractive surgery procedures, the goal is to lower the refractive error to as close to 0 as possible. But I tell them, nobody's 0. So there will be some leftover refractive error, but still vision will be good, probably as good as your glasses. So we need to monitor your healing, and there will be some visual fluctuations because I don't want him to think it's magic that the next day it's good. This is a correction for today's measurement. You will grow old. And when you grow old, the refraction will change, your eye will change, you will age. And you may want some glasses, or you may not, or you may want some change in ICL, or you may not. There's always this question in the back of the mind. If you do this, is this forever? Right? And we need to lower that, temper that expectation in a way that is related to their biology and their growing old.
This video is just one part of our series looking at the guidelines on building proficiency in phakic IOL procedures. Scan the QR code below to access the entire supplement and learn about common practices from some of the world's best phakic IOL surgeons.